accurately do blood tests identify COPD phenotypes? Imagine trying to solve a puzzle with some pieces missing. That's similar to how blood tests help identify different types of chronic obstructive pulmonary disease. Blood tests alone can't give a full diagnosis, but they can reveal useful clues about the disease's characteristics. COPD is a complex condition with many patterns, called phenotypes, which include how it progresses and how patients respond to treatment. These patterns are not always obvious from symptoms or lung function tests alone. Blood tests can support the diagnosis and help classify these phenotypes more precisely. For example, some blood markers are linked to specific COPD types. Higher levels of C-reactive protein, which signals inflammation, are often seen in people who have frequent flare-ups or exacerbations. Low hemoglobin levels, which carry oxygen in the blood, are also common in those with more frequent exacerbations. Eosinophils, a type of white blood cell, can help identify patients who might respond better to inhaled corticosteroids. These markers can give doctors a better idea of what's happening inside the body. Other markers like the neutrophil to lymphocyte ratio and eosinophil to basophil ratio are also studied. These ratios might help distinguish between different COPD types, such as those with more inflammation or more flare-ups. However, these ratios are not always consistent and may vary from person to person. That means they are helpful but not definitive on their own. A rare but important blood test looks for alpha-1 antitrypsin deficiency, a genetic form of COPD. This deficiency involves low levels of a protein that protects the lungs from damage. Identifying this deficiency early can lead to specific treatments and better management. People with this condition often develop COPD at a younger age and may have a different disease course. While blood tests can give helpful clues, they are not perfect. Factors like age, sex, and other health conditions can influence results. That's why doctors use blood test results alongside symptoms, lung function tests, and medical history. Combining these pieces helps create a clearer picture of the disease. In practice, blood tests are most useful for identifying people at higher risk of flare-ups or those who might benefit from targeted treatments. They are not used alone to diagnose COPD but can guide treatment decisions and improve overall care. So, while blood tests are a helpful tool, they work best when combined with other assessments to understand each person's unique COPD pattern.